The silicone Air-Q3 self-pressurizing and Air-Q3 self-pressurizing gastric intubating laryngeal airways are designed with ease of use and patient safety in mind. The Air-Q3 self-pressurizing airways are indicated as a primary airway in applications which do not require an endotracheal tube. It is also especially suited as an aid for intubation in difficult airway situations when an endotracheal tube is desired. The tethered removable connector is color-coded for easy size identification, and when removed allows intubation through the Air-Qsp3G tube. The anatomical bowl and built-up mask heel improves mask placement and seal. The guide ramp helps to facilitate intubation and direct the endotracheal tube or scope toward the laryngeal inlet. The epiglottis elevator lifts the epiglottis and opens the airway for maximum access. The innovative Air-Qsp3G design incorporates a small internal opening under the heel of the balloon between the lumen of the breathing tube and mask cuff. This creates a communication between the airway tube and mask cuff. When delivering positive pressure ventilation, the increased airway pressure will instantaneously increase the pressure within the cuff, creating a seal. The Air-Qsp3G airway has a channel on each side of the tube which enables gastric access. Select the proper size Air-Qsp3G airway according to patient weight and mouth opening. The Air-Qsp3G intubating laryngeal airway is individually packaged sterile and intended for single patient use. Gather the equipment needed for placement of the Air-Qsp3G airway. Aseptically remove the airway from the package. Use a water-soluble lubricant to lubricate the mask's external surfaces and ridges. Avoid placing lubricant on the bowl of the mask. Inspect the patient's mouth and remove all removable denture devices. Ensure the patient is properly anesthetized. Position the head in an extended or sniffing position. Open the patient's mouth and elevate the tongue. A mandibular lift is recommended. A tongue blade placed at the base of the tongue may also be used. Place the front portion of the Air-Q3Sp3G mask between the base of the tongue and the soft palate at a slight forward angle if possible. Pass the Air-Q3G mask into position within the pharynx by gently applying inward and downward pressure, using the curvature of the Air-Q3G mask and airway tube as a guide. Now rotate the Air-Q3G airway forward and inward, aiming for the base of the tongue. Minimal manipulation may be necessary to turn the corner into the upper pharynx. Continue to advance until fixed resistance to forward movement is felt. Pull back slightly and reseat. Correct placement is determined by this resistance to further advancement. Be sure to not over-insert the airway. An alternative method is to place the back of the left index finger behind the mask, flexing the finger forward to help guide the mask around the corner into the pharynx. Secure the Air-Qsp3G airway in place. Check the Air-Qsp3G connector to ensure it is fully engaged within the airway tube and attach the connector to the appropriate breathing device. Check for adequate ventilation. For example, monitor end tidal CO2. Check for bilateral breath sound and chest expansion. Prior to intubation, the laryngeal musculature and vocal cords must be relaxed, either by an aerosolized local anesthetic or with the aid of a muscle relaxant. Then pre-oxygenate. Select the appropriate size endotracheal tube. After checking the endotracheal tube cuff integrity, completely deflate cuff before insertion. Use a water-soluble lubricant and generously lubricate tube and cuff. Next, Disconnect the Air-Qsp3G airway from the breathing circuit and remove the tube connector. To remove the connector, place the airway tube between the index finger and thumb just distal to the connector. With the other hand, rock the Air-Qsp3G connector back and forth while pulling the connector outward away from the airway tube. Pass the lubricated endotracheal tube into the airway tube and distribute the lubricant within the shaft by moving the endotracheal tube up and down until it travels freely through the entire airway tube. Insert the endotracheal tube to the appropriate depth, depending on the Air-Qsp3G size. This will place the tip of the endotracheal tube proximal to the opening within the mask cavity. There are several techniques used to advance the endotracheal tube into the trachea and through the vocal cords. Using a fiber optic endoscope or bougie are common techniques. Follow your standard protocol for advancing the endotracheal tube. Inflate the cuff and verify adequate ventilation. To remove the Air-Qsp3G airway, select the appropriate removal stylet size. Remove the endotracheal tube connector. Next, position the proximal portion of the endotracheal tube between the index finger and thumb and leave enough space for the tip of the removal stylet. Squeeze the tube and insert the tapered end of the removal stylet into the endotracheal tube. For Air-Qsp3G, airway size 2.0 to 5.0, use a firm inward pressure and rotate the removal stylet tapered tip in a clockwise direction until the adapter firmly engages. For Air-Qsp3G airway sizes 0 through 1.5, simply push the stylet firmly into the endotracheal tube. Deflate and lubricate the endotracheal tube pilot balloon before withdrawing the Air-Qsp3G airway. While exerting inward stabilizing force on the removal stylet, slowly withdraw the Air-Qsp3 airway over the stylet rod. Reposition the endotracheal tube to the proper depth and inflate the cuff. Secure the endotracheal tube. Replace the connector and attach to an appropriate breathing device. Verify adequate ventilation.